Uganda has so far registered 2 Ebola cases, both believed to have been imported. One patient died, while the second, a relative of the deceased who had come into contact with him, is currently in isolation receiving treatment. Yesterday, the Minister of Health, through the Uganda Media Center, confirmed that more than 100 people have been isolated and placed under close monitoring after coming into contact with a Congolese man who later died while seeking treatment in Uganda.
The contacts are mostly health workers, people who are treating them, the driver who took them to hospital. And they've all been traced, more than 100 of them. They have been identified, they are quarantined, and they're under treatment. So far, there have been no cases of Ebola reported, which means none of them has posted or has tested positive yet.
Government officials, however, says none of the identified contacts has so far developed Ebola symptoms and all remain in stable condition. As the virus continues to raise international concerns, with the World Health Organization stating that there is still no full proven vaccine or cure, leaders in the border districts say there is urgent need to strengthen the surveillance and establish proactive emergency response teams.
On the danger of the cross-border interaction that we are having, especially in the face of outbreak of Ebola. As we speak now, we have already they are already confirmed the cases of Ebola in Congo, confirmed the cases of Ebola in Uganda, confirmed the cases of Ebola in Sudan. Now we are alerting our people to be very vigilant.
Appeal to the government to do something about Koboko because we are bordering 2 countries which all have Ebola. DRC has, South Sudan has. We need more intervention here.
Uganda, Democratic Republic of Congo and South Sudan have all confirmed Ebola cases, heightening fear of further cross-border transmissions. Today, leaders in Koboko reactivated the district Ebola task force, passing several key resolutions aimed at preventing further spread of the disease.
There is a death today in Arua that we suspect is Ebola. We had 2 cases so far in the country. I think that is the 3rd case. I don't want to see any request for a dispute. And this was 30 days.
Any movement outside Congo. So therefore, those plans to go for that tournament, we have suspended it definitely. Until further notice, when the situation is okay, we shall go and have our day. Are we together? If you insist, I will get you at the border.
Among the measures announced are Saturday ban on music shows, entertainment events, intensified public awareness campaigns, stricter regulations of barriers, and tighter monitoring of public gatherings and places of worship.
Yes, we have 2 designated points of entries where we have been able to deploy screeners who are helping us to do the screening. But there are so many other porous entry points that are not manned. And that poses a very, very huge risk to us as a district. We are trying to work closely with the security teams to see how best we can strengthen the surveillance, but also working closely with the communities.
Meanwhile, the World Health Organization says there are now more than 600 suspected Ebola cases and at least 139 suspected deaths, with the number expected to rise due to delays in detecting and confirming the infection. So far, 51 cases have been confirmed in Democratic Republic of Congo, where the outbreak was first reported, and 2 cases in the neighboring Uganda, according to World Health Organization Director General. Rachel Adid, NTV News in Koboko District.